At the Kimmel Institute, we recognize the pain and discomfort that come with varicose veins and spider veins. That is why we offer a wide variety of services to help you get the results you want to feel your best again. Listen as Dr. Kimmel discusses your options.
Most people who come to the office with vein problems don't really understand what venous insufficiency means. Venous insufficiency is a function of incompetent valves in the veins. I'm going to show you an illustration here that we show all of our patients to try to explain to you what venous insufficiency and venous reflux is. Most veins in the body have valves. These are different from the heart valves, but these valves allow blood to flow in one direction, basically from the foot up to the heart. This illustration here shows what an actual valve looks like when it's open, and this is a cutaway illustration of the valve. In this picture, the blood is flowing in this direction. The second picture shows a valve that's closed, and again, the illustration here shows the closed valve preventing blood from coming back down. Patients who have venous insufficiency have incompetent valves. You see this little hole in the valve that should be closed? That results in two-way blood flow in the vein. Blood flows up and then comes back down. For what we do most of the time, we focus on the great saphenous vein and the small saphenous vein. The great saphenous vein is the longest vein in the body. It starts way down here by the ankle, runs up the inside of the calf and the inside of the thigh, and joins up here in the groin to the deep vein system. In this illustration, the dark blue veins represent the deep system, and the white veins represent the superficial system. Over here, the calf vein, known as the small saphenous vein, runs right down the middle of the calf. Those two veins, the small saphenous vein and the great saphenous vein, are what we usually focus on in terms of closing them down with the laser due to venous insufficiency. This illustration demonstrates the three venous systems in the lower extremity. The white represent the superficial veins, the dark blue represent the deep veins, and these orange veins are called perforator veins. They connect the deep to the superficial veins. Almost every vein in the body has one-way valves. These valves allow blood to flow in one direction from the ankle all the way up to the heart. When there's a problem with these valves and blood flows in the wrong direction, blood goes up and then reverses through incompetent valves, that is often when patients get symptomatic from venous reflux disease. Our goal is to prevent that from happening, and the way we usually do it is to close down these incompetent valves in the veins. Sometimes we do that with what we call thermal ablation, which is the use of a laser, and sometimes we do it with what we call a chemical ablation, where we inject a solution into the vein to close it down. What you need in particular will depend on what areas in your leg have a problem, and we'll talk about that once we examine you and get your ultrasound.
At the Kimmel Institute, we recognize the pain and discomfort that come with varicose veins and spider veins. That is why we offer a wide variety of services to help you get the results you want to feel your best again. Listen as Dr. Kimmel discusses your options.
Sometimes patients will present to the office with large, bulging, painful veins in their legs. These bulging veins are often due to venous reflux disease. What that means is there are incompetent valves in the veins, or valves that don't close all the way. Blood then refluxes or reverses direction and causes higher pressure in the opposite direction of blood flow. As a result of this, some of the branch veins that you can see as bulging veins under the skin can get large. They dilate and they can give symptoms of pain, burning, swelling. You can even get blood clots in those veins. These are not terribly serious, but they can be painful. When patients present with this, we have a procedure that is done in the office with minimal invasive technique that allows these veins to be removed. This is not the typical vein stripping that we did many years ago, which was done in the operating room under general anesthesia. Instead, what we do is we numb up the skin over the veins and make tiny little cuts about 1 to 2 millimeters in size. I then put a small little hook under the skin and tease the vein out. This is called microphlebectomy. If you're having symptoms and if there is underlying venous reflux, then this is usually covered by insurance. When some people present with bulging veins, they're under the impression that it's just cosmetic. In fact, if you're having symptoms and if you have venous reflux, then this may be a covered procedure as medically necessary. There are complications that can develop from these bulging veins. Not everyone needs to have this done, but if you do, we will work with you to try to get it covered by insurance.
Take a moment and follow us on social media. Look us up online at www.thekimmelinstitute.com.